will guide you on what to do when a mammary tumor is very small in its early stages. Most people tend to choose to watch and wait when the cancer is very small. After listening to today's talk, your perspective will likely change somewhat. Today, it would be good to keep these 2 points in mind. The first is the basement membrane, and the second is the enzyme in the stroma. Now, the basement membrane is marked in blue, and you can think of it as a kind of membrane found throughout the skin of our body. The basement membrane and protein-degrading enzymes are enzymes secreted by cancer cells that dissolve surrounding tissue as they grow and seek out blood vessels. Here, you can see early-stage cancer cells. This is the skin, and here is the basement membrane. Below this basement membrane, there are blood vessels. If cancer cells cannot penetrate this basement membrane, they cannot reach the blood vessels. In such cases, we typically refer to it as cancer in situ in the very early stage. If cancer is removed in this state, the chances of metastasis and recurrence are virtually non-existent. However, there is an enzyme that I mentioned earlier which comes from pancreatic juice. It is the enzyme secreted by cancer cells as they invade and dissolve the surrounding tissue. This is used to break down the basement membrane. When the basement membrane is broken, an inflammatory response occurs beneath it. Then usually the lymph nodes. Lymph node metastasis occurs first. Because an immune response occurs around the broken basement membrane, many lymphocytes move there to perform immune functions. Now, as it becomes more concentrated, it leads to lymph node metastasis. Here, if cancer cells begin to spread through the blood vessels, you can now consider that lung metastasis may occur. If lung metastasis occurs, it opens the path to terminal illness in this lung condition. Thus, in the early stages of breast tumors, they may be very small before penetrating the basement membrane, as I mentioned earlier. When the tumor is small in size, if this metabolic inhibitor is used, there is an enzyme secreted by cancer cells, as I mentioned earlier, to break through the basement membrane. It is a proteolytic enzyme. This metabolic inhibitor blocks the proteolytic enzyme. Therefore, over time, the basement membrane remains protected. So, when we apply the tumor metabolism method used in our hospital during this period, this cancer can actually be removed without surgery. If metabolic inhibition is applied, the growth and metastasis of the cancer are suppressed. As a result, the expected survival time significantly lengthens, making the difference between cases with and without lung metastasis incomparable. To do this, fundamentally, the timing of cancer treatment must be properly managed. Now cancer treatment can yield positive results. After this, through metabolic inhibition, cancer is eradicated and contained, and the cancer cells are halted. Dismantling the cancer's protective shield and cutting the blood vessels to restrict the cancer's blood supply. Then, calming the inflammation around the cancer slightly alleviates the effects of the cancer. By addressing these 6 aspects, we will manage the cancer's progression. There are malignant tumors treated with the metabolic therapy method currently used at our hospital. In fact, among the 15 types of cancer, those marked in red are. These cancers actually have no treatment options once diagnosed. In many cases, angiosarcoma patients die within less than 2 months after diagnosis. In cases such as melanoma, cancerous mammary tumors, squamous cell carcinoma, salivary gland tumors, basal cell carcinoma, and osteosarcoma. In fact, you can consider that there is no standard treatment. Even when using anti-cancer drugs, the response is very poor. Therefore, those diagnosed with this kind of disease can contact our hospital, the Rare Animal Hospital. Thank you.